In this video, we are going to learn how you can get help for an addiction, whether it is drug addictions or gambling or social media or whatever it is that you're struggling with. We're going to look at how you can get some help. So I started with Boise State looking for drug addiction help here, and unfortunately, I didn't get very far. Nobody returned my calls. The Facebook groups are no longer active. The numbers are not anybody associated, so that's pretty disappointing. If you need other addiction counseling besides drugs, the normal counseling may help, but let's move on. So here's good therapy. I searched up the area, Boise, Idaho, and on the side here you can see you can determine different specialities. And so I clicked on addiction, and here we have a bunch of addiction counselors. And again, you can click on their bios, read about them, give them a call. If you call them, they will run your insurance and they will tell you what the costs are. So if you're worried about costs, they will help you. We have another really good website. I really like this one. This kind of shows all the areas and their locations, or in the area, all the locations in the area. So I clicked on Access Behavioral Health Services because it's really close to Boise State. Gave them a call. They were really helpful. Basically, if you are concerned about an addiction you have, you can give them a call, whether it's substance abuse or some habit that you have, and they will run your insurance for you and they will see what the costs are. A lot of people are concerned about insurance. Most insurances will cover some of this therapy. If you don't have insurance, they actually recommended that you go to BPA Health, and if you call, they will tell you all of this on the phone. Basically, this is Idaho State funding for substance abuse disorders. So they will help you. If you don't have health insurance, they will help you get that taken care of so that you'll be covered. Or they actually have some grants that can get you help for free. Like I think right now for a month they have it because of coronavirus. Substance abuse issues are going up. So Idaho is giving away, I think, a free month of services. So, again, if you just call them, they will tell you who to call. Let's say worst case scenario, you don't get any funding. You don't qualify for any funding, even though they said that's extremely unlikely. A typical program with Access goes for about 16 weeks. You meet one time a week, one-on-one, and then another time per week with a group. And then you do that. That's what you would call outpatient therapy, right? And worst case scenario, that is $440 a month, which seems like a lot, but if we add that up over 16 weeks, you're looking at $2,000 to $3,000 to get treatment and to move past an addiction that's holding you back, which is probably going to make you more money in the long run. So it's actually not that terrible. If we compare that to, let's say, smoking a pack of cigarettes a day, that's going to be $200 a month, whereas this is going to be $440. They also have inpatient. So let's say, you're really struggling and you actually need to, you can't be going home for whatever reason, right? Because your addiction is that bad. That treatment without insurance or any help is like $560 a month. So again, sounds very expensive, but the likelihood that you're not going to qualify for any funding is very low. So give them a call if you need. They will send you to this website, and then you can apply for more help if you need it. So another thing with this is that we have parents usually, and when we're young, we're probably embarrassed to talk about this to our parents, especially if we're on their health insurance. So that may stop us from getting help. With that said, I would say you should still go for it and help yourself out, right? That's your primary responsibility, is to take care of yourself. And, it can be nerve-wracking to go get help for an addiction because, one, you have to admit you have a problem, right? And all this stuff. And it can be embarrassing because, we want to act like we can handle everything on our own, which sometimes we can't. So I would say is, if you have an addiction and you're struggling with it, get yourself some help regardless of what your parents think. If they don't understand, well, that's just the way life goes. But in the long run, you're going to become a stronger person for getting some help. If you do something like this that's difficult and you are successful, what happens when you do difficult things? You become admirable. And then when you become admirable, you can maybe inspire others to solve their own problems as well and get help with addiction. So, don't be too down on yourself if you need some help, right? Just accept it and go take care of yourself. Okay, and then we have one last option that I wanted to talk about, and this is raise the bottom. So what I was talking about before is just therapy treatments, but there's also lots of medical intervention that we can do. And so raise the bottom actually looks at opiate use disorders. And so these are growing, right? People have access to painkillers, right? These usually come in the form of pills, and then they can become highly addicted, and then that can lead to other drug use. So lots of problems here. But drugs like medication can really help us overcome this because the cravings can be quite significant, especially with opiates. So basically you would call them, same kind of deal, right? If you don't have insurance, there's ways for you to apply to get insurance, but you'll probably not have to pay as much as you think. If I look at the numbers here, let's say you had no coverage at all, and you weren't able to apply for any, which again is highly unlikely, it would cost you $300 a month. And so people typically do it for a year, and so that you're looking at $3,000 to $4,000 for the year, and then hopefully you are over that addiction. And sometimes with addictions you're going to continue to struggle, but you might now have the skills to deal with that. And with this, you'd have one therapy session per month plus daily medication that would help you overcome that addiction. So there's lots of options for you, right? And if you need help, make sure you get the help that you need. Again, I will post all these links below so you can see them. And I think that's good for this video. I will see you in the next one.